Hi, everyone. Welcome to Wellness Chats with Nisha. I'm Nisha Kare, co-founder of Human Biography and Women of Wonder. I'm a director, producer, and a registered clinical counselor. And through this Facebook Live, I'm representing the Stigma Free Society, which is a Canadian registered charity that aims to reduce stigma of all kinds with a focus on mental health. And they promote mental wellness education for youth while providing resources for educators, school counselors, parents, and guardians. And the Society's goal is to create awareness of the various stigmas that exist in the world and develop an understanding of the challenges that numerous people face, and also encourage people to foster acceptance not only of themselves, but also of others. To learn more, visit www.stigmafreesociety.com. And now I would like to introduce our lovely guest, Jocelyn Bystrom. Welcome, Jocelyn.
Thank you.
And so I'd like to tell everyone a little bit about Jocelyn. She's a mental health advocate and educator who has struggled with anxiety and grief. Because of a traumatic incident, she experienced severe and complete physical trauma, daily seizures, some lasting between 10 to 30 minutes. Seems like a very long time, and sometimes up to 8 in a single day. So definitely something that took over her life. She finally ended up in the seizures investigation unit at Vancouver General, only to be diagnosed with PTSD, FND, OCD, and anxiety. And so Jocelyn believes that together we can create brave spaces for each other to break the silence, provide unbiased support, and come alongside and listen with curiosity. Jocelyn is Stigma Free Society's newest champion as part of their champion program. And so, wow, I can't wait to hear all about your story, Jocelyn. Maybe tell us a little bit first about what inspired you to become such an outspoken advocate for mental health.
Well, I think possibly it's because initially I was an incredibly introverted, quiet individual who, although professionally was very capable of speaking out and using my skills and strengths to share professionally, my private life was very personal, and I was very guarded around everything that was meaningful, and I was very private. And most people that knew me didn't know that side of me. So when I was first received the diagnosis, I realized that mental health is a real journey, and that everyone is on the continuum. You know, some days the wheels are falling off the bus, and other days everything's going perfectly. But all of us have mental health, and that there is a huge stigma around having a mental health diagnosis. But I chose differently to not see it as a problem, because I had experienced physical health challenges for 7 years which really did take over my life, and it was quite a surprise to find out that there were underlying mental health issues that had caused all the physical health challenges. So it was unresolved grief, it was loss, there were all of these things that had happened, and my body kept score. So it was an interesting journey in that way.
Wow.
That brought me to a place where I realized that there are probably a lot of other people that struggle in silence with their anxiety, or whether they're having depression or discouragement. And the two diagnoses that I was given were PTSD, which was related to several specific incidents. One which was a large one in 2014 when I lost a treasured career. But it was really that I had previous experiences that were re-triggered by that loss of a career. And so that's why they diagnosed me with something called FND, which is functional neurologic disorder. And it's a group of disorders that affect your brain's software. Like, your hardware in your brain is the part that neurologically does all the work, but the part of the brain that does the software is it communicates with your own body, it communicates with the outside world, and it communicates to the rest of your body. And so what happened in mine is that there were sort of glitches in the software, so to speak, and it caused me to be having these functional challenges, whether they were, I experienced cognitive challenges, I experienced seizures, I experienced rigidity in my limbs, and all kinds of different symptoms that it was really difficult to determine what was the underlying problem.
Wow. And that sounds like, you know, it would take a lot of work to get to the point of understanding what
Mm-hmm.
is going on. And so how long did this journey take from when you first started exploring, like, okay, something's going on, to when you did discover some answers?
Yeah, it was in 2014 actually that I started experiencing something that they eventually called myclonic jerks, and I didn't know what it was. And so, you know, like anyone who has something going on in their physical body, you go to your GP and have it checked out. And the people that I had met along that pathway initially had no idea. They'd never seen anything like it. They said, well, it's very odd. It's kind of, I don't think it's anything. Let's just sort of wait and see. And then the symptoms exponentially increased, and it took a long time to be referred to a neurologist. It's difficult to access those kinds of services easily. I mean, it's not like picking up a phone and phoning your GP. When you have challenges with your mental health, it's much more difficult to access resources and even think that it is a mental health challenge because of the stigma that society has around mental health challenges. And it was interesting because when we think about generating a list of words about mental health, you know, it's really easy to come up with that list. You can think of, you know, people are crazy, they're psychotic, and there's all kinds of words that are filled with stigma, and nobody has any problem making a big long list of those words to describe people that have mental health challenges.
Mm-hmm.
However, if you ask those same people to come up with derogatory, critical, stigmatized words about cancer, they'd kind of look at you like, well, there are none. And there aren't, because there's no stigma to having cancer. It's people understand it's a physical ailment and it's a disease that affects your body, and you didn't do anything to deserve it. And mental health is exactly the same, but we don't treat it the same way.
Wow, that is very, very well said. A great way to put that into perspective, because you're right. It's almost as though people might look to the person experience like mental health challenges as responsible for like what they're experiencing.
Oh, it's because of, you know, they took drugs, or, you know, there's so many rationales and judgment. So much judgment around when we see someone who's either addicted or has a difficulty with, you know, substance use challenges. And we so often don't even begin to think about the layers of potential childhood trauma that put that person in a position where they weren't well enough to look after their own mental health and perhaps didn't have the supports. And that became what they needed to do to survive.
And so for yourself, you became your own advocate. So I'm assuming you had to really like push for yourself.
It was a very big struggle. And I think
you're very educated, you have the language, you have the knowledge, you understand the system, and it was still challenging.
It was still incredibly difficult. And I've always taught my students and my own children to advocate for themselves. And I've taught them how to learn how to advocate for themselves. But I had a sincere struggle with advocating for myself on my own journey, even though I was articulate. And that made it really that much more aware to me that I had some skills that I could use in this way of advocacy, because there are many people who struggle with mental illness that their struggle is all over their face. You can see it, whereas mine appears invisible. And so a lot of people along my journey suggested that maybe I was lying about my symptoms, or suggested that, you know, they were all in my head, so to speak. And literally they were in my head.
They were in your head.
That's a helpful comment. It's much more helpful to approach someone that has a mental health condition, to invite them to be curious about it. If you can approach somebody with curiosity rather than judgment, it goes a long way in providing that person with hope and some self-efficacy to, you know, determine what their future looks like.
Oh, I love that. You know, it's just like a simple way of interacting with anyone. really, right? Not without judgment, but just with curiosity. And so, in your story, it really shows a strong connection between the physical health and the mental health.
Mm-hmm.
Can you explain a bit more about that to us?
Well, that's where I was so fascinated initially, kind of gobsmacked because I hadn't been able to drive. Having seizures means that, obviously you're not going to be driving. And I really, there was another whole layer of grief and loss around my career, my independence, my ability to drive. Like, so many things had been taken from me through no fault of my own. And it's really interesting. I have recently read, what's his name? Vessel Van Kolk. Darn, it slipped my memory. Anyways, there's a really good book called The Body Keeps the Score. And it is so well written, and it's so powerful for anybody who might be struggling in silence to just understand the layers of, what goes on in your mental health and how that affects and triggers your body.
It's so powerful. Even like Dr. Gabor Mate wrote a book about like when the body says no, right? That really changed things for me as well, realizing that your body, when your body's reacting or not doing what you want, or something's different, or you feel right, it's actually probably connected to something deeper, and that your body's trying to tell you something. And if we don't pay attention to it, it eventually comes out in different ways.
Well, that's exactly what happened in my body. Initially, the body spoke in quiet, gentle ways, hoping I'd catch on and pay attention. And being the stoic, capable individual I wasn't listening to those messages. And I wasn't, I think one of the things that that they suggested in The Body Keeps the Score is that children who experience perhaps not having their needs met, like my needs were met beautifully in many ways, but my emotional needs were not necessarily met well as a young child. And you learn that it's scary and it's dangerous and it might not be safe to express that anger. So you start to distrust everything and everyone. And in doing that, you're creating this layer of self-protection, which is a good childhood strategy when you don't have the ability to use more functional strategies. I mean, as a child, you manage what you have to manage. But those strategies didn't serve me well when I was an adult and lost my job. I was still using those childish strategies, and it helps. I think one of the really important pieces and layers along my journey would have been that when I did lose that job, instead of sort of internalizing it and struggling with the loss and the grief of that, which really felt like something inside of me had died. I felt like I'd lost something incredibly valuable to me, and that it was so life-changing. It was like a death in the family. And I didn't know how to express that grief. I didn't know how to learn to manage that. And I didn't understand. And I was in such a state of shock that I didn't reach out for support and proactively ask for some help around how to manage this grief and loss of this treasured position. And so it was, if I would have received then, like if HR or leaders or CEOs realize that when someone is struggling with their mental health, and if they looked through a lens of curiosity and said, I see you're struggling right now, we have these resources available through HR, or had given me a little bit of a roadmap when I didn't realize for myself that I needed some support, that would have been incredibly helpful. But those conversations are closed down. And that's such an important reason for why we need to reduce stigma in the workplace and create, these brave spaces we talked about earlier.
100%, I agree. And thanks to Cindy, she wrote that The Body Keeps Score is by Bessel van der Kolk.
Thank you for that.
And so
the brain part.
Yeah, no, that's quite the name. So I think you got part of it. And When you were going through these challenging times, you're going through it both mentally and physically, you said it was really hard. What were some of the things that started to like help you get through one day to the next?
Well, there were many. When you are in the thick of it, in the dark of it, and the discouragement of having 7 years of no diagnosis, nothing that explains why your body is having all of these challenges. I had assessments of my cognition. I couldn't remember the day of the week. I was really struggling. I was experiencing central apnea, which is when the brain forgets to tell the body to breathe. And I was passing out and having seizures. So
Wow.
my body was in significant distress.
Yeah.
And what helped, there were many layers. So one of the first things, of course, were family. Family was everything. They were the people that were rock solid for me. The other component, although when I was really discouraged, was faith. Just having that spark of hope and knowing that someone else other than me was in control. And I like control. I like to feel prepared and organized and understand and know. And it was really difficult for me to have experienced all these massive symptoms while not knowing a diagnosis. So I was just so longing for a diagnosis that many people, when they first get a mental health diagnosis, really struggle with that diagnosis. But I was in such a different position because I was so pleased to finally understand what was happening in my body.
Some answers.
And the good news is, for many of the functional neurological disorders, there's treatment, there's help, there's mental health support that helps you. There was a time, like I'm standing right now, there was a time I could not stand unsupported.
Wow.
There was a time when, I couldn't walk for 5 minutes without having a seizure. I was wearing a life alert button for 4 or 5 months because my family were incredibly worried about, what would happen if I stopped breathing while out on a walk.
I bet.
So just to wrap up that question, I worked really hard because I knew that it was important for me to take care of my body, although I had very little energy. I did work hard to keep walking because walking in the forest kind of lifted me up out of that dark, deep, discouraged space. I worked really hard to make sure I got enough rest. And I continued to ask for help. I just was asking in the wrong places. I was asking all of the medical health practitioners and neurologists. I had a team of 11 neurologists, and they were amazing. They did everything in their power to figure out what was going on. There was a panel across North America studying my very rare abnormal EEG results. And despite all of those efforts, I still kept having these incremental challenges with seizures. And it wasn't until I got that label and some understanding around it. And there's an incredibly good brand new app. If you just look up FND, that helps people understand. And it's becoming such a prevalent, it's very unknown, but it's becoming such a prevalent diagnosis in our culture because so many people have had experienced some kind of trauma in their past, or even like the pandemic. As we experience these things, our bodies keep score. And I would think that in the coming years after the pandemic, we will see more and more functional neurologic disease because it's bound to occur with the climate in the world right now.
Yeah. And I think as we go through this, people are going to experience a lot of different emotions and see what it's like to be out in the world and when people react to you on different things. And so, with the stigmas that you've experienced with your diagnoses, like how has that impacted you?
Well, initially, when I thought about it, I didn't realize that I had experienced much stigma. There are 4 different kinds of stigma. There's overt and covert stigma, and then there's overt self-stigma and covert self-stigma. And I think one of the biggest ones that I experienced was covert self-stigma. I didn't realize that I was discriminating against myself. In that I wasn't seeking the right kinds of support, and I was completely unaware of that. the other kind of like overt self-stigma is when you discriminate towards yourself in the present and it's obvious, but you're not always, I wasn't always open to that idea. So it's interesting that during a 7-year period of diagnostic observation and procedures and tests, I mean, they were seeking MS. They were looking to see if I had Parkinson's, brain cancer, brain tumors. Like, I went through a series of steroid infusions. Like, the amount of investigation and observation, it never even occurred to me that it could be an underlying mental health challenge. And that's a result of our socialized understanding of stigma. I mean, there's a discrimination against having a mental health diagnosis. So we don't want to look there first.
Right.
And there's some fabulous new courses. I mean, most of us have taken a first aid course and we get a lot out of it. We think, oh, well, we want to make sure we understand first aid for our friends and family if anything ever happened, or, if you were on the roadside and you saw an accident, you wouldn't drive by thinking, oh, well, the ambulances will get there soon. You'd pull out your really rusty first aid skills and do whatever you could to help and support in the interim until the professionals arrived. But are we prepared in that same way with mental health first aid? And there are new courses available, and I think that everyone should be taking them. Yeah. I think that, through the Mental Health Commission of Canada and mental health first aid, every employer should have every employee taking a mental health first aid course so that we can support one another in the workplace. And as a result, we would have much more functional workplaces, if we reduce the stigma.
It's a great idea. Such a smart idea. And what do you recommend other people could do towards eliminating stigma in their own lives?
That's a good question. I think the important piece there is eliminating the self-stigma first, recognizing what it is, learning exactly what it is, that it's a stereotype, it's a social stigma, and a prejudice. It's a discrimination against in the disapproval of a person based on just social characteristics.
Right.
And it can be for so many different reasons. And when you become more aware, you change the whole lens that you see all of healthcare through. You begin to realize that healthcare isn't only about your physical body. It's about your spiritual body. It's about your emotional, your mental health, your psychosocial health. Like, it's about all of the layers. And in order to be a well-functioning individual in society, you need to take care of all of the pieces.
Oh, it's so important. And just for people to become aware, maybe even from a younger age, like that life can head in many directions, and like how to even help and how to even know how to proceed and to be gentle with yourself. It's
absolutely so the self-advocacy piece is really huge. And I think we can't hear it often enough. Yeah. We're worthy. We deserve to have our needs met.
Yeah.
And it doesn't mean we're entitled to have them met, but we deserve to have them met. We're worthy. And it's important that we learn that it's okay to speak up and say, I need this, I need this.
I love that you said that earlier, that there is help available. It's just sometimes I think people might suddenly like cave in and feel like, oh, this is it and this is over and I can't do anything. I can't tell anyone and I can't even function. But no, it's that you can tell people and you talk to the right people and there is help and there are things out there, and it's just finding the right path.
It's interesting, even in making self-care decisions for yourself. Like right now, I'm on a medical leave, and I was meant to go back in this past January, to my teaching job. And I chose not to because it actually took a whole year when one medical practitioner wouldn't sign some paperwork that enabled me to get the support I needed. So I had my diagnosis last February, and 1 year later, I'm having my first appointment that's going to be supportive at the end of this month.
Wow.
So I just said to my employer, and HR completely understood, this is a situation where I love my work. I'm passionate about what I do. I love being an educator, and I want to be back in the school.
Yeah.
However, I want to be well-rounded and wholly well before I come back, because otherwise I won't offer you value and I won't be ready.
No,
So
so
I'm going to return in September after I've had a chance to, you know, gain a bit more support and feel a little bit more confident, even though my my disability is invisible.
no, it's such a brave and smart move, Jocelyn. And so
Well,
we have about
I
5
hope
minutes
so.
left.
It's interesting because I do have some anxiety about going back to work. Like when people talk about, oh, so you have a mental health diagnosis, and what is that? You know, like I think there's going to be some challenges as I go back to work for sure. As people wonder, is she really capable of doing her job anymore? And she is. However, I think when you asked that question earlier about why I feel it's so important to become a mental health advocate, it's that I have been in the workforce for 25, 30 years, and I understand the workplace and what isn't there in terms of support. And I think, okay, here I am on medical leave. I'm getting myself well, but I can simultaneously encourage others to look through a new lens and help reduce stigma so that not only when I go back to the workplace, but when others who are in the workplace and perhaps still struggling without any support start to hear and encourage conversations in those brave spaces.
I love that. I love that you're, you know, you're being called, right?
I do. I feel that way. Yeah, and I'm actually really appreciative for two different kinds of therapy that really helped me in that I took some art therapy and painting and just discovering how to use some of my creative ideas to help me understand what I have moved through. And I'm also
in the background of Jocelyn there, that is a painting that she created. She created that. She painted that beautiful piece behind her, and it's stunning. I love it.
Oh, thank you. And the other thing that really served me well was I took a UBC Brain Health offers an incredible program in that when they treat, when neurologists treat you, they don't only use medical therapies, they use complementary therapies, and they have a whole program for people with chronic health conditions and who are struggling with brain conditions to explore using complementary therapies to what they can offer. So one of the really cool ones was writing your story for people with chronic pain. And so through that, I got started, and I'm actually currently writing a book about
Congratulations.
all my experiences. Thanks. I'm really excited.
And do you have a title yet? Do you know when it's coming out?
I have had many titles, and some of them need explanation. So I'm not going to advertise yet because I'm still in process. But amazing. I am excited to be working with a writing coach and editor in New York. So that's pretty cool. And we're hoping to have it done maybe by summer or September. We'll see.
That's very exciting.
I'm learning a lot about the publishing process and that it takes a long time to get a book published if you want to do it the traditional way rather than self-publish.
Wow. Well, congratulations. That's so amazing. And other great work that you're doing is with the Stigma Free Society. And so maybe tell us a bit about the work that you've been doing so far.
It's really exciting. And it comes back to mental health in the workplace. Yeah. As an educator, I'm really excited to see that they've got a student mental health toolkit that's quite in depth. And I've been involved recently in collaborating with a new toolkit, which is for school staff. It's not just for teachers. There are many adults that work in the building, and everyone needs that toolkit. And so I've started collaborating with them on their toolkit for school staffs. And also I wrote one of my first articles for them about educators as emotional laborers, as our nurses and doctors, and then the costs of compassion fatigue and burnout in the public school setting and in all school settings. We need to look after our children and teach them about mental health and about, right at the start, not teaching them and continuing to socialize them about the stigmas of mental health. We need to just open up those conversations with our students and with our are people in education. So right all the way through, it's really important. So I feel excited about that work with the Stigma.
Yeah, and it's like sharing these stories. Maybe as your last comment, you can tell us about like how sharing your story has helped been, a healing part of your journey.
It's been very significant. I think it's sort of taken my fear and anger and grief and loss and enabled me to have a voice to express it.
Yeah.
I would never talk about it, and now I'm not talking about it for my own gratification. It does support my wellness to just go through all of those experiences, all those hospital admissions and rides in ambulances and seizures where 30 minutes in length, and my husband's looking down at me in terror, and I'm terrorized because my whole body is convulsing in a massive big seizure that I'm fully aware of.
Yeah.
And
Wow.
processing all of that through writing really helps. So I would really encourage anyone listening that if you are experiencing any kind of struggle, that you give yourself a voice.
Yes. Yeah, that's very powerful. So thank you, Jocelyn. Thank you so much for joining us today, for sharing your story and being inspirational to show that you can use your voice through all that you have experienced. And in fact, that is part of the healing journey.
Mm-hmm. Thank you.
Thank you. So thank you everyone for watching. Please use this as an opportunity to share and discuss with each other, and just know that no one is alone. There are resources out there, and you can have the support that you need. And so thank you again, Jocelyn. Take care, everyone, and have a wonderful day.
Okay, thanks. Bye-bye.
Bye.